Hi, everyone. Nice to have you joining us via video. My name is Emma, and I'm here with two other co-presenters, and we are proud to represent Cochrane. And we are going to be discussing Cochrane's work in building capacity and strengthening evidence-informed decision-making in the African region. As I said before, my name is Emma Persad. I represent the Cochrane Governing Board, and I will let my co-presenters present themselves. So Solange.
Hi, everyone. My name is Solange Durão. I'm co-director of Cochrane Africa, and I'm a scientist based at the South African Medical Research Council in South Africa.
Hi, everyone. My name is Emmanuel Effa. I'm the Deputy Director of Cochrane Nigeria, but I also work at the University of Calabar in Nigeria.
Fantastic. Okay, so I will just give an overview of what we will discuss in this video. I will start by giving a brief introduction to Cochrane and discuss Cochrane's new scientific strategy for 2025 to 2030. Then Solange will take over and talk about Cochrane Africa, and Emmanuel will then talk about Cochrane Nigeria. And we'll just wrap up by discussing a little bit about how you can find your place within Cochrane. So as an introduction to Cochrane, if you don't know what it is, Cochrane is an international network focused on evidence-based medicine and present across 190 countries. Now, this network is comprised of researchers, health professionals, patients, carers, basically anybody interested in health and in improving health outcomes for everyone, everywhere. Cochrane is also an independent charity and a not-for-profit organization. And importantly, we do not accept commercial or conflicted funding, which allows us to produce trusted evidence without some sort of financial conflict of interest. Now, why is this important? So for the past 30 years, Cochrane has been recognized as a gatherer and summarizer of the best available evidence, all to improve healthcare knowledge and decision-making. Now, we hope for Cochrane to be at the heart of health decision-making worldwide, and we have three goals to pursue this. Goal 1 is to produce trusted evidence. Goal 2 is to advocate for this evidence. And Goal 3 is to inform health and care decisions. Now I will move on to discuss Cochrane's scientific strategy for 2025 to 2030. Sorry. So why did we develop a scientific strategy? There are millions of people dying and suffering worldwide from preventable illnesses each year. And due to this, we recognize the need for relevant, timely, and high-quality evidence to inform these big global health challenges. We also noted that a gap remains in making trusted health evidence accessible and usable for those who need it most, particularly those in low resource settings. So our strategy aims to bridge this health equity gap. We want to do this by streamlining processes, focusing specifically on the most pressing global health issues. And we also want to work with researchers who are more diverse and more representative of those whom we aim to support with our evidence. Now, when making our scientific strategy, we worked with collaborators and we developed a dynamic scientific strategy. Dynamic meaning that it should adapt depending on the global health issues as they rise and as they fall. Now, we mapped health challenges worldwide, and we did this starting with the Sustainable Development Goals. From this, we then identified research priorities through engagement with internal and external advisory groups and also with the Cochrane community. And now that we have these research priorities, we want to collaborate with national and international organizations to be able to deliver on our goals. So overall, our research priorities for 2025 to 2030 are the following: maternal, newborn, and child health, multiple chronic conditions, infectious diseases and pandemics, and climate change and sustainability. Now, our commitments remain the same. We always want to collaborate and involve, innovate in methods, promote health equity, and champion research integrity. And my last slide will just wrap this up with a nice graphic which describes our strategy. Left-hand side, you can see our commitments. In the middle, you can see our research priorities. And on the right, you can see our strategic purpose for the strategy, which is to improve people's health worldwide by producing trusted evidence for those who need it most. And now I will hand over to Solange, who will present a little bit about Cochrane Africa.
Thank you, Emma. So I think part of the entities within Cochrane that will be helping it implement the scientific strategy will be geographic groups, of which Cochrane Africa is one. So Cochrane Africa is a geographic network that was officially launched at the Global Evidence Summit in Cape Town in 2017. But importantly, this was a culmination of long-term partnerships that had been built across Africa since the 1990s. The network comprises 5 hubs in different sub-regions, different regions of sub-Saharan Africa. So we have the Coordination Hub, which is based at the South African Medical Research Council, the Southern Hub, which is led from the Center for Evidence-Based Healthcare at Stellenbosch University in South Africa, the East African Hub, which is led from Cochrane, Kenya, the West African Hub led from Cochrane, Nigeria, and then the Francophone Hub, which is led from Cochrane, Cameroon. And importantly, all the hubs have a remit of countries where we're trying to reach and expand the work of Cochrane and of Cochrane Africa. The overall vision of the network is to increase the use of best evidence to inform healthcare decision-making in sub-Saharan Africa. We have 4 main objectives, namely to produce reviews that so that we can deliver timely, high-quality responses to priority questions that are relevant to global health and to sub-Saharan Africa, to build capacity in the region to do systematic reviews, and particularly Cochrane reviews. We do this through a lot of training events that we do ourselves, or through giving out bursaries for people to attend relevant training events that are happening worldwide. We advocate for evidence-informed decision-making. We have a biannual newsletter. We also host a regional event where we try to talk about the work of the network and bring in all sorts of different stakeholders to attend this event, among other activities. And we want to increase the access to and usability of Cochrane products. One project that is recent and that encompasses a lot of these objectives is the Global Evidence Local Adaptation Project, through which we're trying to enhance evidence-informed guideline recommendations for newborn and child health in sub-Saharan Africa. And the project basically comprised of a program of work starting with identifying the priorities for newborn and child health in 3 countries in sub-Saharan Africa, Malawi, Nigeria, and South Africa. And from there, we either searched for evidence syntheses or conducted evidence syntheses on these priorities that would inform deliberations of guideline development groups in these countries, where they would make recommendations on the priority topics identified. And then the evidence identified and the recommendations made would be shared to all the relevant stakeholders in bespoke ways. And alongside all this work, there was a capacity building component on guideline development and evidence syntheses, not only for the researchers, but also for the decision makers involved in the project. And also then a monitoring and evaluation component. Another example of a project specifically linked to increasing access to Cochrane products is the translation of plain language summaries and abstracts of Cochrane reviews that many of the hubs have been involved in. This is an example on the slide of translations into French that have been done by Cochrane Cameroon. And then Cochrane Nigeria has also been involved in doing translations into local languages. And we in the Coordination Hub have also been involved in translations into Portuguese. There are many ways that you can contribute to Cochrane Africa and the work of the network. You can be an author of one of the reviews that we are conducting, or of a review that is important for our setting. You can help us identify priorities for future Cochrane reviews. Help us raise awareness about Cochrane and Cochrane Africa in your specific scientific community. Help us write summaries or commentaries of Cochrane Africa reviews or Cochrane reviews that are relevant for the continent, and also help us identify funding for the network's activities. If you want to get involved, please do complete the form on a website. You can see the link on the slide there. So it's a form called I want to get involved with Cochrane Africa, and on there you can specify the different ways that you'd like to engage with us, or feel free to email us. There's an email on the slide as well, and follow us on Twitter, or X, should I say. And then lastly, I mentioned before that we host a regional event every few years. The next one is going to be held from the 14th to the 15th of May, 2025, next year in Kenya. And we are very much looking forward to it. So please do save the date, and more information about this will follow. And now, thank you, and I'll hand over to my colleague, Emmanuel.
Thanks, Solange, and thanks, Emma, as well. So this brings us to Cochrane Nigeria, which was established as a branch in February of 2006, and it became one of only 2 centers in sub-Saharan Africa in 2020. And over this time, Cochrane Nigeria is engaged in training activities where over 140 Nigerians have now been involved in Cochrane activities as authors, consumers, consumer network members, or members of staff of Cochrane Nigeria itself. Cochrane Nigeria is now run as an in-country network. Obviously, considering the size of Nigeria, we now have nodes across different regions where we've got members involved in the activities of the center. So essentially, our core activities include the provision of training, mentoring, and support, particularly for the conduct of systematic reviews, as well as other knowledge translation activities, which I'll speak about shortly. And these training activities include visiting fellowships, internship programs, one-on-one mentoring, and one of the flagship programs, the Reviews to Africa program, which was a joint initiative between the South Africa and Cochrane South Africa and Cochrane Nigeria. And the other activity is the promotion of access to Cochrane Library, as well as evidence-based healthcare reporting, especially involving journalists, where we have journalist workshops, and consumer workshops, particularly aimed at promoting access to the use of Cochrane Library, the evidence therein, and promoting evidence-based reporting. So these are the knowledge translation activities that we've been involved in. We've been involved with a lot of support for clinical practice guideline development, working with policymakers, professional groups, and in some other cases, multilateral and bilateral agencies that work within the Nigerian evidence ecosystem. We've also been involved in translation of Cochrane reviews into local Nigerian languages, where we produce jingles, particularly in priority conditions for which evidence exists in the Cochrane library. And we've also been involved in a lot of consumer engagement involving professional groups, journalists, and other members of the public. And the other core activity we're involved in is influencing policy and practice, particularly working with the Federal Ministry of Health in Nigeria to provide evidence that guides some policy changes. And these are some of the partnerships that we've been involved in over the years. We've had quite some good partnership with the WHO, the WHO Global Malaria Program, working closely with the Cochrane Infectious Disease Group, where we contributed quite some reviews to the WHO guidelines for malaria, as well as the WHO Reproductive Health and Research Department, where we contributed quite a portfolio of reviews that were included on the guidelines for the management of complications from female genital mutilation. And working more closely through in country with Cochrane Nigeria, with WHO Nigeria Country Office, where we contributed systematic reviews that provided evidence to the Human Resources for Health Technical Working Group that informed the policy review process back in 2020, as well as a work with the Swiss Tropical and Public Health Institute, working on the area of neglected gut diseases, particularly filariasis. And as Solange mentioned earlier, currently we are part of a multinational group that is working on the GELA project to enhance evidence-informed guideline recommendations for newborn and young child health in sub-Saharan Africa. So Cochrane Nigeria now hosts, one of the first pilot Cochrane evidence synthesis units, led by Martins Merimiku. Is part of, as you may know, Cochrane evidence synthesis unit, a part of Cochrane's Future of Evidence Synthesis program that also includes, the thematic groups that Emma had mentioned earlier, and the Cochrane Central Editorial Unit. And the aim really is to be engaged in the production of multi-topic, context-relevant, and fit-for-purpose high-quality evidence delivered in a very timely manner in response to stakeholder needs. And as we highlight, as the lead person, Martins, highlighted, at Cochrane Evidence Synthesis Unit in Nigeria, this provides us a huge opportunity to galvanize the strengths of the growing number of academics, researchers, policymakers who make up the West African hub of the Cochrane African Network, specifically with the aim to produce reliable knowledge products to inform evidence-based health policy and practice in the sub-region. And here's how to get involved with Cochrane Nigeria. There's a website, and to the right, we've got all social media handles. The other way is to attend any of our on-site or virtual trainings, and we've got quite a number of these offerings year on year, and be part of a review team, and of course, volunteer knowledge of translation and stakeholder policy engagement skills to the portfolio of activities that we are currently involved in.
Wonderful. Thank you both for that. So we've discussed a little bit about how to get involved and how to get in contact with Cochrane Africa and Cochrane Nigeria. And just to wrap up, we just wanted to discuss how you can find your place within Cochrane. And just underscore that our diverse and global network is really always looking for new researchers and champions of evidence. And we hope to continue building collaborations within the African region. So please really feel free to reach out, both to learn more and to get involved. And here the link is for the general Cochrane page if you would like to join Cochrane. Now with that, that ends our presentation. Here you have some of the contact information that was shared previously, including my contact information, and we hope to hear from you. Thank you so much for tuning in, and yeah, hopefully talk soon.